So what to do when we diagnose a patient with any heart block? Even though if we see the ECG abnormal or anything abnormal, but we find the patient is absolutely healthy, he is asymptomatic and there is some incidental finding, and until and unless that shows that any intervention is required to be taken, we'll be just diagnosing it and mentioning it, but no any specific action is needed until and unless the symptoms are very hazardous to the person, or if until and unless the symptoms appears. So if the patient is asymptomatic, is doing everything well, and the ECG shows the first degree block or second degree block or the right bundle branch block, then we do not need to worry. We can just leave it, we can just mention it, we can just remember it with the patient and follow up and do anything, but no any specific treatment is required. So always remember that patient is to be treated, not the ECG. We must treat the patient, we must see the patient. Clinical is always greater than the any investigations, okay? Because if the patient is not having any problem and we are giving him the pacemaker for no any reason, just diagnosing the heart block, and we are planning for the pacemaker, and we are doing so much of things here and there, cutting incision over and all, so that will be not a good sign of being a good doctor. So always remember that patient is to be treated and not the ECG. Okay, and then after here comes the first degree heart block, second degree heart block, third degree heart block. As we all know that this all signifies so we all know that this all signifies the AB block or the bundle of His block. Always remember that depolarization normally begins in the SC node and spreads to the ventricle via the AV node, the bundle of His, the right and left branches of His bundle, and the anterior and posterior fascicle of the left bundle branch. And a conduction abnormality can develop at any of these points. And the conduction problems in the AV node and bundle of His may be partial, and the partial will show the first degree heart block, and the complete will show the third degree heart block. So remember this. This is partial, this is partial, this is complete. And the first degree heart block is seen in the normal people, and no any specific treatment is required for them. And but we must be keeping in our mind that the cause may be the acute MI or the acute rheumatic fever. So if you see the first degree heart block or the partial heart block in the AV node, then no any specific treatment is required. It is generally seen in the normal people, but we must be aware that the patient might be having acute MI and the acute rheumatic fever. You can do the investigation for it, and if you find anything, then that you can manage, and if you do not find it, no any treatment is required for the first degree heart block. And in the second degree heart block, if you see over here, it represents the heart disease, mostly the myocardial infarction. And in the Movitz type 1 and the Movitz type 2, no any specific treatment is required. No any specific treatment is required for, while in the third degree, in the third type of the type 3 of the second degree heart block, that is 2:1 or 3:1 or 4:1, permanent or temporary pacing may be required. And always remember that the Movitz type 1 or the Weinke back will always show the progressive lengthening of the PR interval, and then after the non-conducted P wave, while the first degree heart block will be only showing the delaying of the PR interval, but the second degree will show Weinke back will show progressive lengthening of the PR interval, and there will be no conducted ventricular depolarization to the one atrial depolarization. While in the second degree heart block, PR interval of the conduction bit is constant, but one P wave is not followed by the QRX complex, while similar will be occurring in the permanent, but there will be the about 2 P waves for 1 QRS, or the 3 P wave for 1 QRS, or 4 P wave for the QRX. So this is the second degree heart block, and you will be requiring permanent and temporary pacing only for the complete heart block, and for the rest, Movitz type 1, Movitz type 2, and the first degree heart block, you will not be requiring any significant intervention. For the third degree heart block complete, always remember that it mostly represents to the bundle of His, and it is mostly caused by the fibrosis, connective tissue disease, and mostly by the fibrosis than the ischemia, and you can manage with the permanent or the temporary pacing. So always remember that in the AV blocker here, the treatment is required for the type 3 second degree heart block and the third degree heart block, and the rest Movitz type 1, Movitz type 2, and the first degree heart block, no any treatment is required. And now we will go to the right bundle branch block and the left bundle branch block. In the right bundle branch block, always remember for the atrial septal defect, and no any specific treatment is required. But for the left bundle branch block, aortic stenosis ischemia can be considered, and if it is asymptomatic, still you may not need the treatment. But if it comes with the severe chest pain with the left bundle branch block, then acute MI may be the cause, and intentional intervention should be taken accordingly. And for the axis deviation, if that is right axis deviation or the right bundle branch block, you need not to be worried. But if it is left bundle branch block, still you may not need to be worried until if it is followed by the symptoms of the chest pain that might be suggesting the MI. And if the left axis deviation is associated with the right bundle branch block, if it is associated with the right bundle branch block, then no specific treatment might be required because it is to the right bundle branch block. But still, if it is shows a severe conducting tissue disease and causing the symptoms of intermittent complete heart block, then the pacemaker may be required. So the right axis deviation, you do not need to worry. If there is a left axis deviation, it is most of the time it is caused by the left ventricular hypertrophy, and you may find the cause for that, and you can do the treatment accordingly. But if it is associated with the if the left axis deviation is associated with the right bundle branch block, then you may need to administer pacemaker if symptoms of intermittent complete heart block is seen. But if you see the left bundle branch block and with chest pain, then the intervention for acute MI may be required. So these are all the things that is need to be considered while reading the ECG. And always remember that if conduction is normal through the AV node, then his bundle of is and one of its branches, but it is abnormal, the other bundle branch or bundle branch block exists and the QRX complex is wide, and the ECG pattern of the left right bundle branch block and left bundle branch can be worked out if you always remember that the septum if you always remember that in the septum the wave of devolution is from left to the right, and in the lead V1 will be suggesting the right ventricle and the right bundle branch block, while the V6 will be reading the left ventricle and the left bundle branch block as V1, V2, V3, V4, V5, V6. So it will be suggesting for the left ventricle, V1 will be suggesting for the right ventricle. Always remember that. And if you cannot remember any of the lectures of the right bundle branch block or the conductive defect, always remember this quick and short sweet mnemonic, sorry, not the mnemonic but the fact for the V1. If you see the RSR1 pattern in the lead V1, then it is right bundle branch block. Right bundle branch block. And for the left bundle branch block, if you see the M pattern like this M pattern in the V6, then it is for the left bundle branch block. So remember this fact, then it will be easy for you to read any of that. And block of the anterior division of the fascicle of the left bundle branch block causes the left axis of the deviation, and that I have explained already. So these are all the things about the conduction and its problem and what to do when that happens. So let's end this topic this way.